And we're back with a brand new episode of The Untold. Now, if you're in special curiosity for some dental advice, today's episode is a great one for you, so stay tuned. But before that, I'm your host, Abdullah Hindiani.
And I'm your host, الإكثر. And today we're joined by Ali Maarafi, who's a dentist and has had a long career in dentistry and seems to have a great passion for it based on the brief that we've gotten. So I'm curious to see what he has to say about his career choice and how it's been working for him. It's a very important job to have in this world.
It is, honestly, it's a job that is so taxing. Several of my family members are within the medical field, so I know how much pressure, this kind of field puts on people and the amount of courage, I would say, the amount of, tenacity that it requires from them to persevere in these kind of fields. So it's always great time to sit down and talk to them. So I'm really curious about today's episode, talk about his journeys, his, trials, tribulations, and his story so far.
Yeah, it takes a lot of studying as well, which is something I think you and I could not have done to focus that much on that kind of career path. And also, dentists, they work on people's smiles. So with that, smile and stay tuned for the rest of the episode.
We are back, ladies and gentlemen, here on The Untold with our conversation segment. So thank you for tuning in. But of course, most importantly, thank you, Dr. Ali Maarafi, for being our guest here tonight at The Untold. Thank you for joining us.
Okay, it's my pleasure.
It's our pleasure to have you. And so you are a dentist, mashallah. So I want to ask you, what made you choose a career in dentistry?
Actually, I chose dentistry after some conversations and consulting people who are mentors and people who were a faculty at KTV University. We were exploring what the community needed around that time and what's the future of the careers around that time, and we were finding like dentistry was a real opportunity to do that. More than that, I am kind of person who like to socialize and to get connecting with people, and the dental field will give you the opportunity and build your relations and getting to know more people and to get connect with them. So that was another reason why I chose dentistry, and I felt dentistry will be a good option for that. And after 16 years now in the dental field, I would confidently say that every reason I started holds true, and that's it.
It's always great to hear about that because, mashallah, whenever you make the decision to have your career, people don't really think about it, but you're 18 years old at the time. So to see that right now you are very happy about all the choices you made, for 100% sure you made the correct choices. Now, speaking about dentistry, it's such a challenging field, right? It has a lot of its ups and downs. What would you say were some of the biggest challenges you've had in your profession?
The most challenging part in my profession was trying to get the patient's trust, especially who's had a bad experience from childhood fear or from wrong treatment they received from other dentists. So rebuilding their trust, it's not an easy one to do. So that was the first challenge I had with patients. So we try to make it easy for them. So the time they come to the clinic, we try to make it kind of how we are sitting together and like a chat and all these things. So try to hear from them what's their fear and how that fear developed with them. So try to listen to them, make them feel comfortable, make them feel easy in their way they are sitting, and also listen to their concerns, what they are worrying about, what they want to do. This is the first challenging thing I had, that the patients fear. Another challenge is managing patient expectations, because the patients are hoping that the treatment to be done quickly. They would assume that we as a dentist have like a magic stick and with just one move everything will be done. So managing their expectation and their treatment to be done quickly, this is another challenge. So try to explain to them why the treatment will take time, because it might take time because of the healing process, which take time. It might take time because we need to have the interaction with other dental specialties. So it's not about finishing the treatment quickly, it's about getting the final results, which the aim of the final result to be a healthy, long-lasting smile and results.
I love that, and it's so true. I think all patients just wish every procedure could be done in like 5 minutes. As you
I
said,
know.
that magic stick could just come and boom, you're healed. Boom, there's no problems. However, unfortunately, that isn't the way things work,
It
and most
is.
things take time.
Mhm.
And especially when you're trying to deal with patients who are, because it is a very common fear for some reason to be afraid of the dentist, especially at a young age. So, how are you able to kind of help manage that fear and anxiety when trying to also create this, like this knowledge in the patient of what they should expect without them kind of, because they're so afraid, they just don't want to complete things or something?
So usually when the patients come to my clinic, I just like chat with them first and try to know what's their concern and what they are worrying about and what they are expecting. So try to talk with talking to the patient and chat to them. That will give them the chance to feel calm, and then I let them speak. We need to listen to our patients. We need to let them give them the space to speak, to explain what their concerns, to get out of the fear they have. And also we need to tell the patients that everything they're expecting to happen in a good way, it will happen, but we need their cooperation with us and to have to have them being compliant with us. So that's the thing. So usually I give them the space to speak, I give them the space to ask questions, and sometimes if they are not sure about things, I ask them to not decide today and ask them to seek for another opinion. I usually suggest my patient to go for a second opinion to another like a specialist or another consultant in the dental field. And once they feel sure about the treatment you are done, I now take the lead and I explain to them why such a treatment is a good and a recommended treatment for them. Maybe because they have that kind of the dental health or dental issue, we need to fix it in that way. And also try to explain to them what complications are combined with these procedures you are doing. And if there is a pain, you need to explain to them why this pain is there and it's a part of the process. So I realize that being honest with your patient is the key, where they will feel calm, they will be assured, and they will feel you are not monster anymore to them.
No, you know, we always fear doctors, but I don't think any patient sees them as monsters. So, you know, thankfully, you know, you're all doing incredible work on a day-to-day basis. Now, I want to ask you, out of all of those, what would you say is one of the most important thing for you to build that trust within the patient?
As I mentioned, that being honest with the patients, let them feel calm. This is the things like build the trust with them. And also you need to show your patients that you are really taking care of them because of their health and because they mean something to you. So now with the new technology we have and with the social media, we could share like photos, we could share like a short videos and to explain to the patient what kind of the treatments available and what's the results back of that treatment. So these make things much easier to explain and to get them trusted. And also there are sometimes why I tell my patient, if you feel unsure about anything, just come to the clinic. You don't need to feel that it's difficult, I need to make an appointment or something like that. You can walk into the clinic, and if I have a chance to see you and explain everything you would like to know, that will be easy for you. So dentistry is about socializing and connecting with people. I know you as a dentist, you need to treat this patient, but also to make that treatment very easy to the patient and to make it very comfortable to the patient, you need to make sure that you are connected to that patient also.
I feel like it's great that you're able to use knowledge in a way to help the patient gain trust, because it is true that even not knowing something makes something more scary, right? When you have the knowledge about it, it helps relax you. Even if you're not sure what's going to happen, at least you understand what's going to happen.
So that's the reason why we like when someone say dentistry is as a science and art. So it's not just one of them, it's both, and they are both essentials. So science and the dentistry, that means the knowledge, how to treat the disease, how to heal, how to make the teeth looking healthy. But on the other hand, the art is the thing where the teeth looks like when the patient smile, the symmetry of the teeth, the color of the teeth, the way they smile, the way they feel the biting is comfortable with them. So when you have the knowledge and you know how to implement that knowledge into the art, you will get the best result to the patient. And this is when you let the patient smile and get out of the clinic with a confidence.
That's really wonderful. And it brings me back, I want to ask you, because I think a lot of people, when they study medicine or dentistry, they're focusing a lot on the science side of it. A lot of people don't realize how much socializing it actually takes.
Yes.
So was that something that shocked you about being a dentist, or did you go into it knowing you would have to socialize a lot with
And
people?
that's what get me to go more in dentistry, because I know you need to socialize with people. You need to know them more. You need to implement your I would say your social factors that inside you to get to know them more.
See, you know, speaking about studying all of this, let's go back to step A. Before you got into this field, before studying it, did you have any perceptions about it that actively changed whenever you got into the field and studied it?
Actually, yes. Before I started dentistry, I actually thought that it was going to be really tough. And as I said, hearing and that like treating patients who are in pain sounded stressful, and dealing with patients with pain will not be that easy. But when I joined the dental school and begun the dental course, everything is being changing. So learning from great mentors in our dental school and having more hands-on experience that faded all the fears I started with. And plus, when you see with the new technology we are having now, because sometimes you're in dentistry, we're using like the digital scanners and all these things, these all will help you to make your work easy and comfortable to the patients. So the perception I started, it was be a very tough course, but by studying, by having more hands-on work, by seeing more patients, by attending to the dental conferences, by attending to dental workshops, you build up yourself and being more confident that everything will be easy if you make it easy for yourself.
Approach to have to things. I think a lot of people, they don't feel that way unless they really have the passion for the subject as well, which you seem to do.
Okay,
And
thank you.
I want to ask you as well, like, what in your opinion makes the difference between a good dentist and a great one?
A good dentist, he's the one who knows his basic, who knows how to treat patients, who knows how to deal with complications. The great one is the one who, behind that, all the things I said, who knows how to improve the things. For example, we just know that patients like to have a white teeth because the smile, the Hollywood smile, where that's a concept that the patient will have a white teeth. That means their teeth will be nice and their smile will be nice. But how do you apply that Hollywood smile to the patients? This is how would you make it as a great and a good one. Because if someone is used to do it in that way, he will do it forever in his life. But when you go and learn more, and when you go and explore other techniques and other ways to make it the Hollywood smile and the other ways, this is when you are exploring a different path. That's what makes you a greater one.
And also, I'd imagine being a great dentist means you are great at dealing with people, which also brings me back to my next question, is that you said a big challenging part of being a dentist is the social aspect of it and gaining patients' trust, you know, talking to them, making them feel comfortable. So are those skills something you had to learn, you know, as you got into dentistry, or were you something, you know, natural at as soon as you got into it?
If you have it at a natural end, it will be much easier for you to deal with the patients. But one of the things we had in the dental school, back in the dental school, you need to know the way to speak to your patients. So one of the things they are very essential in your course, it should be the professionalism. So the ethics should be there every time you deal with your patients. The way you dress, the way you talk, the way you greet the patients. So they are not teaching you these. At least they give you the basic about that. And this is where, how do you apply it and how do you improve it in yourself? So being socializing, if you have that, let's say, that's the thing inside you, this is very good, but improve it, that will make you greater.
I think it's great that you're able to kind of see this difference and apply it in your own way. It goes back to what you were saying about dentistry being a kind of art as well as a science, right?
Yes.
Because I think that the good dentists, they only focus on the science side of it, but the great ones, they make it their own art form, like you do. Like they turn it into an art with how they improve it, how they make it their own way of dealing with the patients. So I think that's really wonderful. So do you think that you're always having to improve yourself as a dentist?
We should. Otherwise, if you don't grow, you'll still feel behind. So growing by means learning more, attending, like as I said, dental conferences and workshops, because there are lots of the updates coming in the dentistry in terms of the technology, in terms of the digital and all these things. And you should get yourself improved and grow.
It is, and that's always comforting to know, right? To seek improvement, especially from, people in positions that actively help people on the daily, schedule. With that being said, we are going to take a very quick break. We'll come right back after this one.
And we're back from that short break. So we're talking about your amazing journey in dentistry. And I want to go back to what you were saying also about how you've studied it and how it keeps changing from when you first studied it many years ago. So even though you studied it, you said you've been doing it for 16 years, but there's all this new technology now. So do you have to keep learning all about all this new technology? Are you always studying?
Yes. It's kind of what's called continuing education. So there are some researchers started like in 1960s, and then other researchers comes in 1970s, and then researchers in 80s. So we need to keep ourselves updated about all these researchers until now we are 2026, because there are some classical part of the treatment, but with more research are done and more materials have been invented in the dentistry, we need to see these materials or these kind of the treatment, we need to get a follow-up about them. So how would you make sure that the treatment you're doing to these patients is the best the treatment, or it's an evidence-based treatment? That's didn't come as an evidence-based treatment unless there was like a research and there was like a follow-up about these kind of researches. So of course we need to keep up ourselves updated, we need to keep ourselves improved in terms of this knowledge.
It is, and mashallah, I can attest firsthand to the improvement of technologies in dental work, because 2 years ago I had my teeth alignment worked, and then the doctor showed me a 3D composite of how they will look like a year and 6 months in advance, and then that completely blew my head. right then and there. I was like, is this authentic? Is this accurate? And he's like, 100% accurate. And now 2 years later, the 3D composite picture that I saw 2 years ago is exactly how my teeth look right now, which just blew my mind even more. So the technology in medical field is amazing, and to know that you're actively seeking them is always very happy to know. Now, when it comes to dentistry, you mentioned earlier in the episode that sometimes you deal with patients who are stressful, have a lot of pain, and you got to go through all of that. So in a lot of situations where high pressure is on you, high, responsibilities fall on you, how do you deal with these moments and stay calm in the moment?
So if I had like a patient like this, I usually don't kind of try to judge them. I let them come to the clinic, let them sit in the chair, let them speak, because they want to tell everything what's inside them, because they feel they have the right. So I let them speak, give them a space to say everything they want, even if it was something wrong. And then once they are kind of told everything they wanted to say, and then I try to calm them down, say, okay, I'm here to help you, I'm not here to judge you. So the problem you have said, I try to break it in small like bits, and try to focus on every details he said and try to solve that problem. Because sometimes the patient, they come with like an idea that an old dentist broke my tooth. And so I didn't know exactly what happened before. So when I let them speak and it say everything they wanted. I let them sit down, relax, and then, okay, let me kind of evaluate and inspect your teeth. So when I look at their teeth, I can tell sometimes if there's something like an older problem happened or something has been done wrongly. I try to fix the things step by step. So if there was like a problem maybe happened because of another dentist, I try to tell them that something happened in the past that's haven't been done right in the right way, but we can fix it, because everything in dentistry can be fixed. Even if you end up having the tooth extracted, now with the dental implants, everything can be fixed again. So I try to keep them calm down and build our trust, the confidence, so they could continue in the treatment. So the key is about having the patient speak, because if you judge them from the beginning, they will have a big conflict with them.
I think it's great that you're able to kind of put so much effort with the patients and allow them to speak and do all of that. I feel like it can be, you know, a bit tiring sometimes. So what would you say for you?
It's part of their job.
Yeah, I'm sure in general there's a lot of things that can be tiring, but I want to ask you, like, what is the most physically or mentally draining or tiring part of being a dentist for you?
It's not like very tired, but you know, it takes from your effort, because like sitting in a dental chair for a long day and try to bending your back and bending your every time you want to work in them, there's something physically irritated. But mentally, when you think about the best treatment to deliver to the patients, because every case may be different. Although although like when someone come with a dental decay, I know it's a caries tooth and dental decay, but this kind of treatment I could deal it with that way. The other kind of caries would deal it in another way. So the mentally thing is, how do you apply your science and your knowledge in that way? So I wouldn't say it's a mentally irritated, as more as mentally expanded,
Yes.
to get the best treatment for that patient.
Now, also, you're in a very unique position where someone in your position and role affects the daily life of 20 patients and improves them, right? A person's smile can turn them from being completely sad into the happiest person on earth. So when you're dealing with all these stories on a daily basis, what would you say is one of the most rewarding thing about your, career, about your role?
I would say the most rewarding thing is feeling or seeing the patients smiling at the end. So when you remember the first time they come to your clinic and how was their face and their facial expressions, and once we done with the treatment and how they feel, this is the most rewarding part. Plus their gratitude, their words, the thankful words, it means a lot to us. Although it takes time from us, but at the end, when you see them happy, that's the most rewarding part. I remember that story when I was back in dental school. I was in the third year, so that was in 2007. And I still remember this story, because at that moment I felt I did something very nice to that patient, and that fuels me to do more and more. She came with no upper teeth in her upper jaw, and she has multiple teeth in the lower jaw, and we decided to do a complete upper prosthesis, which is a removable thing that's been put and removed. And for the other one, it's a partially removable prosthesis, so it has some teeth because she has other natural teeth. And because you are doing like removable prosthesis, it took multiple appointments, starting from taking impressions, like primary impressions, and then we called them back again for the master impressions, and we called them for the third time for doing the occlusion or the biting, because she doesn't have teeth, so we need to record her biting. And once we reach the fourth appointment, which is a very essential appointment for them, because we will do a try-in, which we call it like a prova for them, so they will see their teeth, how they will look like, how they bite, how they smile about that. And the final appointment, which is the fifth appointment, is delivering the final prosthesis. And I remember that final appointment, when she came, she was very happy, and the first time when she sat in the dental chair, she grabbed a green apple out of her bag and she put it on the table, and I was a bit shocked. So what's going on? She said, finally today I could leave and I could eat my apple with a big smile.
MashaAllah.
So that's the thing, and it fits nice. So in the final appointment, we just did a little bit of adjustments, and we gave her that final prosthesis. And before she left the clinic, she put the apple in the front of me, and to see how she was happy at it. So that's the most rewarding thing. Seeing them feel satisfied, seeing them feel trusted, seeing them feeling happy with their smile, that fuels us to do more. And at the end, you will feel that we as a dentist, we are not just doing the clinical work, we are doing a nice human work to the people, and that's what makes it worth.
Honestly, I think it must be an amazing feeling for you to give someone their smile back. Like, how does it make you feel?
It feels me happy. Of course, it will feel me happy, because when I see the thing they were looking for, they are looking for, and it's been delivered in the nice way, the way they like it. Of course, it will let me feel happy and satisfied.
Yeah, and that's such an interesting story as well, because it's also such a long procedure. There's multiple appointments. I think a lot of patients might lose hope at one point if they're going for so many different times.
That's the thing. That's what we try to tell our patients. Dentistry is not about getting things done faster and quick. It's about multiple appointments that might take time, that might get interactions with other dental specialty. The final result is the main result, because we want to give you a healthy, nice smile which lasts forever.
It's also, and you know, speaking about lasting forever, I think a message you can send out to especially our younger audience out there who are curious about or considering pursuing this career, but a lot of them are afraid because, you know, they hear stories, oh, it could be 8 years of studying, could be 10 years of studying, could be this and that. So, you know, what do you have to tell them, you know, to encourage them to pursue this kind of career and consider this career path?
First thing I will tell them that the time will pass. I've studied for 9 years and a half between the bachelor and between the specialty until I became what I am. I'm still learning. So I remember the first time when I studied abroad, that was back in 2002. And now we are in 2026. So the time passes. So focus on your goals, follow your passion, learn from your great mentors. Dentistry is a very nice job. It's incredible.
It seems like it is. The way that you talk about it, it's not what I would expect, especially when you mentioned the social side, how it feels to bring people their smile back. I think a lot of young people, when they think of pursuing dentistry, they're only focusing on maybe what their parents tell them or about only how teeth kind of work in general. They're not thinking about how it can be an art form as well, how it can be a social thing as well, how they can make connections. So I want to thank you for sharing that side of dentistry with us, because it is something I think a lot of young people, once they hear about it, it might make them want to pursue it more. And so I want to ask you, because you said that you're still studying, you're still evolving, where do you see yourself in the future with dentistry?
I still see myself as a clinician because I like it. Although sometimes I give lectures to the residents and I give lectures to the students and I teach them, but the day I am in the clinic, I feel myself more as a clinician who likes to do his work and deliver like the best treatment to the patients. So when you have like the effort and the health to do a good of yourself in dentistry, you can keep it.
And that's such a reassuring words, right? From the people in charge of maintaining your health. It's always assuring to know that you are actively in love with your career path and also pursuing improvement in everything. So we do want to thank you for that, most importantly, but also for being our guest on the Untold for tonight's episode. So thank you, Dr. Ali.
Okay, thank you so much.
It was a pleasure to talk to you.
It's my pleasure, thank you.
And I wish you the best of luck with, continuing your career, because it seems to be a very amazing career.
Okay, thank you so much. It's my pleasure.
And with that, we are going to take a quick break. And we're back from that short break. And honestly, Abdullah, I love talking to Dr. Ali. The way that he approaches dentistry is very unique to me. I've never seen it as both an art form